my name is Shaden McClellan. Today, I'm going to basically talk to you guys about hypomobile joints. So, if you do not use it, you will lose it. Did you know that most of your aches and pains in your body are generated from your big toe? I'm going to try to show you how you can get rid of those aches and avoid some simple injuries caused by those hypomobile joints. According to Lisa R. Callanan, a professor at Cornell Medical University, the second most common injury reported in adolescent athletes is medial tibial stress syndrome, or you and I just know that as shin splints. Today I'll be discussing your body and how simple movements can be impaired by firstly explaining what a hypomobile joint is, secondly explain some ways to identify if you have one, and finally I will cover some simple ways to start to improve your mobile joints. Starting with hypomobility. What is a hypomobile joint? It's basically a joint that has a decreased range of motion. According to Bethany Cadman of Medical News Today, most commonplace for calcium buildup is in a shoulder socket. So some of the ways that you'll lose your range of motion, especially in your ball and socket joints, are calcium buildup. If you don't move it to its full potential, then eventually calcium will start to build up. Another way is you don't use the muscle groups needed. Something that a lot of people don't realize or maybe even know is that your toes should be able to wiggle as easily as your fingers. It's something that every one of us in this room was born with, and we just didn't utilize it, so we lost the ability to do it. So basically what I'm doing is I'm talking about getting mobile. According to Telegraph Mobility, the ability to move freely in a joint is its full range of motion. And I understand a lot of you are probably thinking, well, what's the difference between flexibility and mobility? While they are very similar, you cannot use them interchangeably. Easy way to think about it is flexibility is the muscles around a joint and their full range of motion, and mobility is your joint itself. Another way to think about mobility is its flexibility plus strength. So that being said, mobility is a vital portion of strength training that is just undermined. People don't realize that if your muscle doesn't move to its full potential, then it can't be as strong as it can be. It's just as simple as that. So now that we know what a hypomobile joint is, what are some ways to identify it? The easiest way is if you're just experiencing pain in a certain area. If your knee is constantly hurting or your shoulder hurts and it's just not going away, no matter how much you ice it, heat it, stretch it, or whatever, it's probably telling you that something's wrong and you need to address it in a different manner. According to an article by Cesar Fernandez of the University of Juan Carlos Physical Medicine and Rehabilitation, joint hypomobility and muscle impairments are indivisible. So you can't have one without the other. If you have a hypomobile joint, it'll lead to a muscle impairment, and a muscle impairment will always lead to chronic pain. Imbalances when you perform a movement is another way to tell if you have a hypomobile joint. Just as simple as if you are leaning to one side when you sit down, or if you can't do push-ups on your hands because your left wrist doesn't bend back as much, so you have to do it on your knuckles. Basically telling you that something's not moving and it should. Imbalances are actually the cause of the injuries that you will receive. Over time, your muscles overcompensate and overwork for the muscle and joint that aren't moving. And they'll get tired. If you're using something way too much and it has to do its job plus 2 or 3 other muscles and joints jobs, it's just a matter of time before it wears down and you injure yourself, tweak your back, hurt your knee. It can be avoided. The American Academy of Orthopedic Surgeons reports that shin splints are the cause of muscles in your tibia being overworked. Shin splints, like I said, are in and of itself a perfect example of an injury caused by hypomobility. people don't realize when you run, every step you take is being absorbed 2 to 3 times your body weight. So if you do that for 5 miles, you're putting a lot of stress on your legs and on your joints. And if your joints and your foot aren't working and your shin has to make up for it, it's the fastest way you'll get injured, and it adds up really fast. So now identifying the problem will make it easier to finally fix it. Some simple ways to fix a hypomobile joint. For your ball and socket joints, there's something called a controlled articulate rotation, or abbreviated as CARS. And it is defined by Dr. Spina of active movements that are performed on the outer limit of your rotation. So basically, you will do exactly as that says. You will take your ability to move it and you will press on, basically. And your brain's gonna wanna tell you not to do that. And you have to fight through that because you're gonna be gaining strength, and your brain will always accept moving on if it's gaining something, and that thing is strength. Another thing that people stray away from when they're doing this is when they hear snapping and popping, they think it's a bad thing. Contrary, that's actually good. That means you're freeing up space. A lot of the times that's just your ball and the socket going over the calcium buildup. And it just means that you're freeing up space that wasn't there before. And tricks for other joints that aren't ball and sockets, is for any joint and any muscle group around, something called progressive and regressive angular isometric loading, or PAILs and rails. So for PAILs, it's going to be you'll want to think of elongating. So if you were just to do a simple knee to your chest stretch, you are isometrically loading the muscles that are lengthening, so your hamstrings, your glutes, and rails is the regressive. It's shorter, so you're going to want to think about your quads and your hip flexors, and that's just basically getting the muscles around your joint a better range of motion. And you can do that for any joint in your body, from your foot to your knee to your elbow. So in short, I discussed your body and how simple movements can be impaired by first explaining what a hypomobile joint is. Then I explained some ways to identify if you have a hypomobile joint. And finally, I covered some simple ways you can start to improve your hypomobile joints. So next time your lower back hurts or you have a slight knee pain when you're running, you can start to address the problem the correct way before it gets too serious. And always remember, if you don't use it, you'll lose it.